afternoon, everyone. Thank you so much for joining us here at Future Labs. We are Randox Health. We are the headline sponsor of this Future Lab here at Goodwood Festival of Speed all weekend. We thank you so much for joining us. And it's such a great partnership for us and for all of us here going to be hearing all of the insights in today's sessions, which I know you'll thoroughly enjoy. But we are all about innovation. So Randox are innovation, we are intelligence, we are all about health, well-being, and looking after our bodies with huge amounts of data generation, huge amounts of technology, and huge amounts of testing that really keep us all in peak performance. So whether you're an athlete, whether you're interested in your career success, your family's well-being, we really do everything at the earliest stages to find the little signs where you can focus in on health optimizations that actually keep you younger, stronger, healthier, and preventing chronic conditions. This is our technology. It's the Randox biochip array technology. One of these little white squares can run up to 100 different tests on a small sample of your blood. And that data can get reported some of them in 7 minutes, some of them in less than 20 minutes. So we're all about rapid data generation and all for you. You get to personalize your health. And somebody that knows all about that, we have John here, who is a medical doctor. He's going to be sharing some wonderful insights with us, but super interesting background. So we're talking about your elite background, John, in the Special Forces, and how military-grade health optimization is now really being made accessible and available to the public. So without further ado, please tell us a little bit about your own background and also how you're really bringing things to the forefront of your career now and how the public can benefit from that.
Hi, everyone. As Katie said, my name's John. I'm a former Special Forces medical officer. My job when I was deployed was obviously looking after the guys and managing battle casualties. My job when we were back on base was really thinking about how we take care of between 30 and 60 of the kind of fittest guys on Earth. One of the things that we realized was that having any sort of a conversation with these extraordinary high performers about their health was actually really difficult because they never wanted to acknowledge the fact they might get sick. And I think that's true for a lot of people out there today. But if you actually begin to reframe the conversation with a Special Forces operator in terms of performance, so we're no longer talking about, hey, we want to prevent you getting sick, we want to get you to go further, do better, do more, then actually you can start to have a really interesting conversation with them. That then led to me helping design and develop something called the Human Performance Project. We actually call it the Operator Performance Project. So that was taking SF operators, Special Forces operators, and trying to optimize them. That then has led us to setting up a company called Andata that Randox have been instrumental in helping us get off the ground, trying to take that same approach to high performers from a raft of domains. It's probably worth just pausing briefly and talking about what we define as a high performer, because obviously we're talking about Special Forces, we're talking about elite, and I think a lot of people might be sat there thinking, well, does that apply to me? And what we have discovered, and the literature is really clear on this, is that a high performer is actually, medically speaking, anybody who's expected to consistently succeed. So what we know is that people are under relentless pressure day in, day out. A lot of the times, exactly as we saw with the SF operators, they can meet that challenge, they can rise to it. They'll sacrifice sleep, they'll often sacrifice their own, dare I say, mental well-being, and they'll be fine until they're not. And so the theory behind Andata, behind the business was, okay, can we intervene early to identify when those signs of wear and tear, when those signs of strain from operating at that upper level can be identified, and can we start to intervene early? So yes, that's the background, and then obviously, I would hope to the audience it would be obvious why we would want to partner with Randox in terms of gathering that sufficient data to be able to achieve that.
Absolutely. So we're really talking about, it's so interesting to think about people who need to be at their peak physical and cognitive readiness. And, What sorts of testing biomarkers are we talking about that have either come from special forces and they've really looked at the pattern of the findings, or maybe some unexpected things that you're really helping people with now that you're doing these special packages from Andarta as well?
So what we find is it's never one single test. The approach that we've taken is to gather all the data that we're able to now generate, so hundreds of data points, but really importantly what we do is we sit down and we actually contextualize it in terms of what the high performer is attempting to achieve in their life, because one set of data points for one individual are going to mean something entirely different to another. And actually we found that looking after the SF operators was that it was always about trying to figure out who and what they were at that stage in their career, who and what the operation or the mission was that they were going on, and that would subtly alter the advice that we gave. So there's never a single test, but things that we do see consistently, or things that let me take a step back. Things that we're looking for are twofold. One is there evidence that they are under excessive strain? So are we seeing elevated cortisol levels, elevated inflammatory markers, decreased immune function? Then we're also looking for opportunities within their physiological system where we can reduce risk. So what we know is that operating at that level is going to place a strain on your cardiovascular system. So what we're looking to do is to say, look, are there areas of risk that we can just take off the table? So can we intervene really early to reduce the risk of cardiovascular disease? Can we intervene really early to improve hormonal health? And at the same time, what evidence have we got on blood testing that correlates with how the client is feeling? So if they're telling us that actually they're really up against it, how does that tie in with what their immune system appears to be doing, with what their inflammatory response seems to be doing? So it's never about a single test. It's always about context. It's always about trying to understand the person on the other side of the blood tests.
Yeah, and that's exactly what Randox see and specialize in, is this interlinking of everything in the body and everything that's traveling around in your blood. And if we all choose our favorite car here today at Festival of Speed and compare, it to someone's health, whether they're, a slightly older vintage model and they're wanting to find out all about, their own diagnostics, and they don't have as much technology and they don't quite go as fast as some of our sexy supercars here today, then, choose your car, choose your analogy, but essentially you'd still want the hundreds of tests to try and work out how do we keep this in tip-top form, and how do we get the flags up on the dashboard before, anything actually goes wrong, to get that oil change or whatever it is. But please times that by, the fact that it's 2025, the fact that Randox have been doing blood testing for the top hospitals, labs, doctors, scientists, research institutes around the world for the past 50 years. And also, not just being experts in our field, but knowing that the human body is actually much more complex than our cars. That's a fun fact that you learned today, that we, of course, already knew. So we're talking hundreds of data points for you, repeated throughout the year, so that you can essentially be Googling yourself or ChatGPTing yourself, or whatever your favorite new AI model is, because you can finally download that information that's going on inside, traveling around your blood, see it on paper, see it in your dashboard online, on your Randox Health app, and all of the fun, techie, intelligent ways that we help it become user-friendly, and that we actually help people understand what it is that their results show and how to use those to actually solve for combating chronic conditions. Don't develop them in the first place, then you don't have to treat them. When you get symptoms or when you have a niggle, it's ultimately too late. And, John can, correct me as a doctor or agree with me fully, like he probably will, but we want to see things really early on and fix them. And, as all of our doctors and scientists say, it is the earlier settings and the earlier findings that really make the difference. And we really see that in examples such as prostate cancer. So Randox, who release new tests every 2 weeks, Randox, who can run over 150 tests in less than 2 hours on your blood sample for Joe Public, Randox, who have brought all of the expertise of lab testing to the high street, to the public, with 50 different locations around the UK and Ireland alone, and a few more starting to pop up in America, which has given me my American, British, Irish twang, depending on what mood I'm in. But, Randox are really making this available and affordable to us. So I need everyone here today to take a really important message back with them, which is prostate cancer testing. Randox now have an advanced panel, which is 4 tests, not 1 PSA test alone, because PSA has actually been found to be it's been outperformed by this new panel. So it lowers the false negatives and it lowers the false positives, which means that from a non-invasive blood test, you can actually be taking away a much more reliable screening test. Let's not say diagnostic test. But you're taking that screening away at whatever age somebody wants to avail of their prostate cancer testing. And really, it just equips that individual, that man, with information earlier on, and ultimately better peace of mind. But most importantly, for you to share with your friends and family, is that when a man has a higher BMI, PSA testing can also be masked. So it can actually be not reporting correctly or feel the man because of the higher BMI. Whereas when you get the PSA test on the panel of 4, then you're actually able to have a much more reliable finding for men with BMI. And John, I want to hand it over to you. Just speak to us, with your with your medical background as a doctor who's been practicing for so many years. Speak to us a little bit just on this really important subject of prostate cancer and screening, and just the innovation of tests coming through, because you've obviously been doing this and studying this yourself in actually application. So talk to us a little about that, please.
Yeah, so I think I'd really just echo everything you've said there, which is that, so not knowing how much the audience know about prostate cancer, it's incredibly common, and there's a bit of a myth that it's something that is perhaps not as dangerous as other forms of cancer. Nothing could be further from the truth. The challenge that we have as doctors for men is that when we undertake a blood test, something called your PSA, if it comes back as positive, it's very difficult to know whether somebody does or doesn't have cancer. If it comes back as negative, it doesn't necessarily mean they don't. So unfortunately, what that means we have to end up doing as doctors is sending a lot of men for a biopsy, which is an extremely uncomfortable, and potentially it has some risks to it. So that's where we actually insert a needle into the prostate gland, take a piece of tissue and look at it under a microscope. Now, what Randox are doing, which is fantastic, is honing in on the accuracy of that PSA test, so that blood test that we do. And the way they do that is by correlating that test with a load of other markers as well. So now, finally, what we have as doctors, is the ability to run a single blood test that with far greater certainty, if it comes back as negative, we can say, no, we believe that you're okay. And if it comes back as positive, then we can say with more certainty, yes, we think that actually that very invasive, potentially hazardous test is now justified. For us, it's difficult to overstate how much that changes things, particularly for the guys that I've been looking after. So prostate cancer affects men of all ages. Everybody, I think, believes that special forces are super young guys. They're actually not, and that's the first point in someone's life when we start to see that increase in prostate risk. So for us, it's been huge. Yeah.
Okay, wonderful. And then, just staying on kind of this thought of, I see people that are interested here with us today of kind of their fitness and their athletic performance, even just their gym numbers and scores and, their own personal workout journey. So, with your experience in elite soldier resilience and obviously men that are training so hard for such long periods of time, what would you give as some kind of insights that might, be markers of overtraining, or maybe speak to the supplementation or testosterone or whatever sort of kind of stress markers, fitness markers that you find would be of interest. But also, there's overtraining too, and there's familial heart matters, and, short of getting everything measured like we're talking about today, where could someone start to really, on the high street, apply this to their lives?
Yeah, so it's really interesting because what we've seen in recent years is a huge rise in people taking their own fitness and their own training really seriously, which is great. But there's a lot of information out there now, and what we see increasingly are that people are taking training advice from well-meaning influencers, I suppose, and they're applying it to their own lives, and it just doesn't apply to them. So if you are a young guy trying to put on a little bit of muscle, for example, maybe not listening to a professional bodybuilder might be, it might not be wise to listen to somebody who does this for a living. So what we tend to see is that we see people from all sort of activities, all walks of life, beginning to overtrain. And we've had at least one client recently where this is a guy who was just putting in dozens of miles of running weekly, not fueling adequately for it. And what we began to see, what we saw when we began to look after him was significant immune suppression, significant evidence of something called hyperprolactinemia. Basically, one of the hormones that secreted by his pituitary was elevated, all of which began to indicate overtraining. Now, where that's been great for us is that this guy was frequently exhausted, frequently run down, frequently getting ill. I think that without those blood panels, if we had just turned around to him and said, look, we're not really sure what's going on, can you do a bit less? Somebody of that level of motivation is just never going to listen to you. Actually having those data points to say, look, we are seeing biochemical evidence of you merrily running yourself into the ground, then it sparks a conversation where we can then, for us as a clinic, say, look, we get that training is really important to you. We get that your performance is incredibly important to you. Can we now have a conversation about how to train better? So how to achieve what it is that he was trying to achieve in his life, in his career, but without the immune suppression that we're seeing, without the endocrine disruption that we're seeing. So again, it's never a single thing for any one particular patient, but the things that I'd commend any athlete, any high performer to get checked would be any evidence of immune suppression, any evidence of raised inflammatory markers, and then any evidence of endocrine disruption, but making sure that that's being appropriately interpreted by a team that actually understand who you are, what you're trying to do, and can also then issue advice for you to fix it. I think it's one of the reasons I think that sometimes people are hesitant about getting these tests done is because they worry about what comes next, and increasingly there are people out there that can support this. There are people that can interpret those results and actually put in place methods to help you correct whatever gets found.
Yes, we like to worry, and we like to worry even about becoming the worried well. So we're going to worry until we realize that these results are actually answers. They're actually peace of mind. I always like to say to our American clients over in LA that data is direct access to answers. And really what you measure is what you can manage. So back to Randox, obviously measuring hundreds of different things. Even your shortlist there for fitness alone was probably close to 100 different tests in those panels. And our panels are very extensive. Just to give you an example, we're talking about pre-disease states. So we're hoping that there's no actual diagnosis so much as, if you find that you're in pre-diabetes, that is a reversible state. That is something that can still be prevented, corrected, and fixed in the body. So we're applying that combating chronic conditions across the board to your health. So in our heart health panel, it's not just your standard cholesterol and trigs. Hi, there's our friends who are going to come join us, no? But wanting to throw me off, but I'm not going to forget. Heart health with Randox has 25 different tests in a panel instead of just your standard 5. And that's what we do across the board. We're talking about the absolute full hormone panels, not just a home test kit or a finger prick kit that somebody might get for 2 or 3 tests. And with heart health, we're talking about the most atherogenic. You taking my picture now too? too, thank you. So the most atherogenic particles. So lipoprotein small a is a test that's not commonly made available, but actually is the most atherogenic, so plaque forming. So things that if it's starting earlier on in life is really going to do damage, and people potentially don't realize that there's inflammation to do with just the heart, and inflammation is going to make it harder for the body to absorb nutrients, and therefore make it harder for IGF-1 to raise during your sleep and have for healthy sleep. So John, talk to us a little bit about inflammation, these plaque forming markers, apolipoproteins with Randox Health, and how with LP small a, there's that genetic predisposition, which is good to know, but also just good to track them changing over time, because men especially do, have this kind of family history in some cases where they've heard of a friend that had, an uncle or a father, and at 50 years old they had a heart attack, which is much younger than any of us would like to think about or like to think about in our own family and friends setting. So a little bit on heart health and, your kind of top tips for us on what to track, and is it actually easy to then pull those markers back into the green? Do you see people making real benefits in their own health and results?
Well, yeah. I mean, I can go you one better than that. I can describe a recent case that we've had. A guy in his early 50s who had actually previously been an athlete, been extraordinarily fit, had taken a little bit of time away from training because he'd had an injury, and then came to us wanting to climb Everest. So he wanted us to get him back up to full fitness. Now, before we did that, we ran a full heart health panel. So that's over and above what you, I think, would probably normally get if you asked for your doctor to carry out a risk assessment. We discovered that he had an elevated level of this particular molecule, this particular marker, LP, known as LP small a. And it was very raised. Now, bear in mind, this is a really healthy guy, not a smoker, blood pressure was normal, never had any of the other conditions that would make us worried about him having heart disease. On the basis of what we found on that panel, we decided we were going to do some more advanced testing on him. And lo and behold, we found that he had a significant, what we call lesion, so a significant blockage in one of the blood vessels that supplies the heart. We are absolutely convinced that if this guy had then attempted to climb a mountain with this, that something terrible would have happened. I think at the very least he would have had a heart attack, and I think it's reasonable to say that he probably would have died halfway up Everest. So all that is to say, let me finish that actually. What we were then able to do was to put him onto a whole host of treatments to address that plaque. We got him referred to specialists, and he's now doing very well. He's not going to climb Everest, but he's going to go up a different mountain early next year. So what's the point of this is that that's a guy who has been extraordinarily fit his entire life, and the devil really is in the detail. These advanced markers, if they're correctly interpreted, will uncover issues that can be corrected, that can be solved well ahead of time. Part of my previous role was I used to fly on the air ambulance. So a lot of us within the military, within special forces, do that to maintain our resuscitation skills. And tragically, we would frequently go to heart attacks. A lot of the time, men who had decided, and it's great, they had decided that they were going to start getting themselves fit and well, and had unfortunately not taken into account that they had accumulated nearly a lifetime of damage, up until the point where in their 50s they've decided to start doing something about this, have then gone off and started exercising, which is great. I don't ever want to tell anybody not to exercise, but had not perhaps risk assessed that as well as we would have liked them to have. And yeah, I've been to quite a few resuscitations that unfortunately ended badly. We didn't get them back. So that's really my take home, is go and get these things checked because at the very least it's going to give you a sense of where you're at. But I think for the vast majority of times, in the vast majority of cases rather, it's going to enable doctors to intervene, to carry out treatments, to get other loved ones checked, because as Katie mentioned, a lot of these markers, a lot of these risk factors are actually inheritable. And so yeah, the straightforward advice is it is always better to know. I know as guys, we don't ever want to. We want to put our fingers in our ears and pretend that, you know, how we were in our 20s, super fit, could stay up all night, that's how we are in our 40s and 50s. I'm sorry, guys, it just isn't the case. So yeah, go get checked. I can see you guys looking at each other. Yeah, you.
Yes, because we are quite hard on our bodies in this day and age. And whether that's from, you know, working out hard or not working out enough is hard on your body. And whether we're yo-yo dieting or under-eating or overeating or eating the wrong foods, you know, we all know what we're kind of supposed to not do and to do. But yet the rate of chronic conditions is still increasing. So there's great that it's now got the data factor to apply, to actually apply personalized information, unlock the keys to our own bodies. You know, if someone's in a constant state of insulin and they're in a fat lock mode, like, so they can't turn on weight loss, or they can't build muscle, or they don't have enough hormones and there's a dysfunction, and everything is just interlinked with thyroids and the whole endocrine system. We see it time and time again every day at Randox Health. And it's these small things too. You know, most people get kind of 70% of their report that gives them peace of mind, that they see this is working well and I feel great about this, and I'm so chuffed to know that, you know, I don't have any liver, kidney, heart health matters. But really my nutrition shocked me, because, you know, they could have been taking supplements and thought that they were working, eating a really healthy diet, or as they thought, but they might have a gut issue which stops them actually absorbing some of the nutrients. So they might see deficiencies even in iron, and in just running the whole extensive panel. I'm sure you see, as we do, that, you know, you need to know your stores of iron. They can be too high and they can do long-term damage to you later in life, but not really right now. And then also with iron, as you were saying about the fitness, you know, we have people that come to us and they're regular hikers, or, you know, they were on holidays at a higher altitude, and, you know, just to be short of breath and have that concern actually translated into a little anemia and a little early stage of, you know, that plus their gut health and whether they absorbing the iron that they turns out that they were eating. So it kind of goes into a little personal quest, and people can gamify it and, you know, get better reports every 6 months from Randox, and really see their results improving. Also, just to mention quickly, these are all also available as home test kits. So that means that if you've had your big package from your venous blood draw, you can then get a home test kit and get a few panels checked throughout the year easily as well for, you know, £50 or so. And then a urine sample in a home test kit in a private box to the lab. Totally private sexual health testing for anyone who's sexually active. They should be looking after their sexual health, understandably. So 10 different STDs which are linked to fertility and just linked to little infections that shouldn't be in the body, and they can all be resolved and treated. So a few of my favorite top tips. So John, back to you on what you would say to people that, you know, with your background being kind of in the most high pressure situations, dealing with stress and obviously the stressors on the body, and then helping now those clients that actually want to come to Endarta and benefit from the Randox Health testing, and how your services actually deploy solutions for them to benefit, but causes of problems versus the consequences of what you're seeing, any kind of interlinking to stress and people in stressful environments. What tips would you give in that category as a doctor in 2025 for us, that kind of brings us through to the future a little more?
Yeah, so I think the thing that we're trying to do at Andata is when we have a panel that actually comes back pretty clear, which is great. It's fantastic, and I think it gives a high-performing client an awful lot of reassurance. But what we don't want to do is to then step back and say, okay, we know nothing about your life. We're happy to just retest you next year. Our approach is to take that testing and to say, okay, now let's look at what we call the allostatic load, what the overall pattern of high performance might be having on you as a human being, and what can we start to do to intervene. So what performance coaching can we put in place? What physical interventions can we put in place? What nutritional interventions can we put in place? to your point earlier, it's about really understanding the individual and understanding what the hazards of their chosen profession are. So in terms of the advice that I would give to anyone who's looking to perform at that level is you've got to be an advocate for your own health. You've got to understand yourself. You've got to understand what it is that you're trying to do. And I think that it is always better to know. It's always better to have as much data as you possibly can. There's a conversation that's always ongoing about I think people are sometimes worried almost about being overwhelmed by all these data points. And I don't think we need to be. I think that there are increasingly doctors and teams out there that can help you interpret this, that can help you understand this. I think that increasingly there are going to be AI models that are going to help you understand and interpret this. So I think the advice that I would give is that if you are a high performer, if you're somebody that is expected to relentlessly succeed, relentlessly deliver, and that could be anything. It doesn't have to be being a race car driver. It doesn't have to be being a special forces operator. It can be trying to juggle a couple of jobs. It can be trying to juggle the school pickup. It can be trying to get a business out of the door. All of these things take a huge toll on you. Understanding where you're at, just baselining your current state of health, and then working with teams, people that can put in places the kind of strategies and techniques that you need to manage low-grade health risks, as well as optimizing to ensure that your physiology can sustain what it is that you're attempting to achieve. I think that's the advice I'd give everyone, is just be an advocate for your own health.
Absolutely. I love that point, also because it's what we've been trying to do with each of our clients personally through Randox Health for the past 12 plus years now, which is really personalize it for them. So help you understand your results and your report time and time again, and then we all learn together. So there's scientists that are available to speak to our clients in kind of a scientific discussion, theoretical, pattern data way. There's also medical doctors that work at Randox Health that can help explain things or get into clinical diagnoses and treatments for those that want that. And it really is a path of understanding, and it's so powerful when it's personal, because there's obviously blood tests that we all know now are not just for sick people or not to be left until one feels unwell. That data generation comes with a lot of new things to learn, to John's point. So when we give the reference range, we really want to, help inform someone that, for PSA, to go back to the example, an 18-year-old to an 80-year-old are going to be very different men, but that reference range is going to be the same, as in a standard UK, NICE guidelines, European medical reference range. Whereas, to start to learn and really track for you that your vitamin D, shouldn't be around the 30-40 mark. It should be up around the 60 to 80 mark. Vitamin D is used for so much in the body. You can track that with Randox Health. The UK doesn't always get this glorious sunline that I can see in all of your t-shirt tans out there. So when it's winter and we're getting less vitamin D and we're not supplementing, you might see that in your results, and that can then have a knock-on effect into so many different parts of the body, so many different disease states, and that's a simple vitamin D test. So again, that's what we do across the board. Just very quickly before we wrap up, John, but why is it you think that people might wait to burnout or, just kind of unbearable fatigue and symptoms before actually going to get tested? Like, what psychology from your, incredible background with such military and such special forces, the mindset, the cognitive, how do we tap into that and help our family members know that it's empowering to go and get the test early and to treat your body like a really precious car or machine, because also we're treating ourselves like machines every day. So why do people wait so late? How do we all kind of get on the more positive side where more benefit can be reaped?
So I think based on the experience I had with the guys, was that nobody wants to look for a problem, because if they find a problem, they might have to slow down. And again, to use the car analogy, that's nuts, because nobody who has a high-performing car, simply keeps their fingers crossed while the red light has come on and there's some clunking coming from underneath the bonnet. So I think there are a couple of issues. One is that high performers think that any problem they find is going to force them to slow down. And they're absolutely right. But why not flip that on its head and say, okay, if we find this earlier, we're not going to have to slow down. We're not going to have to, it's going to be a quick oil change rather than a complete engine repair, just to stretch the analogy slightly. I think the other issue as well is that I think that people increasingly people are under so much pressure that they just don't believe that anything actually can be done to relieve that pressure. And our approach at Andata is not to tell people that you have to slow down. Our approach is to say, look, here with all of these data points, here are where we see meaningful changes being potentially made. Here are where we see meaningful changes being potentially made, but only with that data can we start to intervene in really tailored and nuanced ways that mean that actually people don't necessarily need to reduce the amount of work they're doing, because, as you say, people are under so much pressure now to achieve, to do more, to go further. But if we can actually take a really detailed look at them, we can say, look, we don't need you to just stop and stop doing all the things that are incredibly important to you. But here are where, to your point earlier, we can make some subtle dietary changes so that you're reducing the risk. Here are where we could maybe introduce some cardiovascular medication in order to just reduce some of the risk. Here are where we could put in some training and lifestyle changes, some sleep advice, some highly nuanced, highly tailored advice that just enables people to do better, not less. And I think it's that. I think people are worried that actually if there's a problem there, they're just going to be told to do less. And that isn't the case if you're working with a team that actually understand how to interpret these data points in the context of who you are.
And the good news is that it all works. So we're thrilled that we get to see it every single day and every single week and month at Randox. We see people's numbers improve, as we say. So that means that more and more goes into the green, goes into the smiley face category of, oh, you got this all in check now. So we see and help people improve and optimize their health day after day, and that's what we invite you guys to do. My name's Katie. I'm a scientist with Randox. Come and speak to me after. John, obviously happy to take any questions. We also have a whole team of scientists over on our stand, and they have discount vouchers for Randox Health, etc. But again, all about preventing chronic diseases and combating chronic conditions developing in the body using the most advanced technology that has been available for many decades now, usually reserved for the special forces and medical doctors around the world that know how important it is to test hundreds of different things. But being made so much more accessible on this technology for the biochip that can run 100 different tests from one small sample of blood. And we run hundreds of tests, and we do it for, starting at less than £50. And we have packages that are available and accessible to everyone in many different ways, shapes, and forms. So we're offering discounts on those to everyone at Festival of Speed. We're sponsoring Future Labs so that really people start to know that these innovations are changing lives, they're saving lives. You're all promising me that you're going to share that the advanced prostate cancer testing from Randox is now really changing things for men. You really need all 4 tests, which includes PSA, but PSA alone is being outperformed now. Anyone that's a man with a higher BMI must get the panel, and that is all 4 tests, because PSA alone is not sufficient for men with a higher BMI, because it can be masking different findings there. So come and speak to us. Us scientists don't get out much, so they'll all be happy to see you, as will I. Any questions for us, that's fine. I'm going to let John close us out. Very exciting, with just your top tip from just your fascinating background of, being in special forces and such high pressure situations, but all of the kind of camaraderie and kind of mission control that must go along with that. What's your kind of top tip for people just to keep their bodies or their brains in, the right direction now that we're, heading into 2026 and everything, that's all the craziness that's being brought to our attention?
Yeah, so I think if there was one thing that I'd say to this audience, it is there's no such thing as too much data. There's only an inability to actually interpret that data. So whenever we were what we call going on a target. So working up a mission set. So when we were going out on an operation, we could never have too much data. We could never have too much information about that target. The key to it is to turn that data into intelligence, is to understand what it is that you're trying to achieve, and understand what's meaningful to you, understand what your own risks are, what you're willing to, I guess, accept some risk on, and what actually really is important to you, what you're not okay with. But by having that approach, of I want to know more, I want to know more about my own body. If the target is your own health, then you simply can't have too much data. You can only fail to turn that into intelligence.